Tremor of upper extremities, worse when taking up or putting down anything. Knees knock against each other when walking. Gluteal muscles and lower limbs emaciated. Medicine Lathyrus sativus. होम्योपैथी अपनाएं, बीमारियों से छुटकारा पाएं. The purpose of knowledge shared here is only educational and to increase awareness. Please always consult your doctor before taking any medicine. Self-treatment may always be injurious. मित्रों नमस्कार, आपका मेरे चैनल पर हार्दिक स्वागत है. इस चैनल को सब्सक्राइब करते हुए बेल आइकन को प्रेस करके ऑल के ऊपर ज़रूर क्लिक करें ताकि आपको आने वाले सभी वीडियोस का नोटिफिकेशन मिल सके. फ्रेंड्स, टुडे वी शैल नो when to use medicine Lathyrus sativus in impotence, locomotor ataxia, lumbago, paralysis agitans, paraplegia, rheumatism, urine incontinence. Dose is suggested at the end. दवा की मात्रा और पोटेंसी अंत में बताई गई है. मेडिसिन Lathyrus sativus. Vertigo when standing with eyes closed. Burning pain in tip of tongue with tingling and numbness of tongue and lips as if scalded. Lathyrus does not produce pain. Reflexes always increased. Paralytic affections of lower extremities. Infantile paralysis. After influenza and wasting. Exhaustive diseases where there is much weakness and heaviness. Slow recovery of nerve power. Sleepy, constant yawning. Athetosis, slow breathing and continuous worm-like movement of the limbs or trunk. Locomotor ataxia, chronic myelitis, tremor of upper extremities, worse when taking up or putting down anything. Legs heavy with vague pains, formication and sense of cold. Unable to stand without the help of a stick. There was no weakness, but the abductors and flexors of the lower limbs felt hard and contracted. Gait uncertain and staggering. Right leg being rather the stronger. He lifted his feet with difficulty, often dragged them and put them down suddenly and forcibly as if they were heavy weights. The floor, he said, felt irregular and he was obliged to keep his eyes fixed on the ground to guide his feet. He rested all his weight on a stick. Movement worse when eyes shut. He felt as if standing between two abysses. He walked worse without his shoes. In bed he could not sit up without helping himself up with his arms. He could not move his toes or flex or extend the foot on the leg or the leg on the thigh, could not extend or close legs when sitting. Voluntary movement of abductor and adductors and rotation of feet impossible. Knee jerk exaggerated. sensibility to touch, heat, pain, and electricity perfect, temperature normal, lumbago, incontinence of urine, complete loss of sexual power, pains in lower and sometimes upper limbs, tremors. The invasion of the disease is sudden, often coming on after a damp cold night. Lower limbs are affected with anesthesia and motor paralysis. Patients show a characteristic gait, the heel in the air, foot in extension and abduction with contraction of muscles of lower limbs and exaggerated reflexes. A strong pressure on bladder with frequent desire to micturate. When sitting had great swelling of legs. Predominating coldness in legs which at night changes to a hot burning sensation with desire to uncover. Respiration, heart and digestion normal. Pressure on bladder so violent that he had to urinate immediately or the urine rushed out of its own accord with great force. Cramps in calves, legs blue and cold, morning and night hot and burning. This recurs regularly every day and lasts a few hours. Pain in back excited by touch and efforts to rise. Cramps in calves, pains in back so violent that he could hardly move. Depressed, hypochondriacal, hardly any movement possible in coxofemoral joint. From time to time, erections and pollutions. Tips of fingers numb, tremulous, tottering gait, excessive rigidity of legs, spastic gait, knees knock against each other when walking, cramps in legs, worse cold and cold feet, cannot extend or cross legs when sitting, gluteal muscles and lower limbs emaciated, legs blue swollen if hanging down, stiffness and lameness of ankles and knees, do not leave the floor, heels do not touch floor, muscles of calves very tense, patient sits bent forward, straightens with difficulty, the aggravation from cold damp wind, symptoms often remain in abeyance until cold, damp weather sets in. Burning heat with amelioration by uncovering. Peri-peri, locomotor ataxia. Spastic paralysis with excessive constipation and violent urging to pass water. If she attempted to retain it, it passed of itself. Muscles hard and unyielding. Back pain was induced by touch, aggravated by touch and aggravated in damp cold weather are keynotes. Ameliorated by uncovering, aggravated by movement, ameliorated lying down, lower limbs move more freely. Men are more sensitive to it than women. It is like nux, a man's medicine. It mainly affects the parts below the waist, lumbago with bladder affections, spastic paralysis. The attack had been coming on 6 months. Unable to make the slightest movement of the lower extremities, even of the toes. Abductors in a constant state of irritable contraction, so that the thighs were constantly crossed. Reflexes greatly exaggerated, no pain. girdle sensation as if he had a cloth wrung out of cold water around his waist, paralysis, multiple sclerosis, a disease in which the immune system eats away at the protective covering of nerves, एक गंभीर रोग जिसमें रोगी अपने शरीर का नियंत्रण क्रमशः खोते हुए दुर्बल होता जाता है. Rheumatic paralysis with stiff knees, cecal core paralysis, blueness ameliorated from uncovering, picric acid paralysis, erections, Telcamara aggravation in damp weather, Lycopodium ameliorated from uncovering, Nux suited to men, Rustox paraplegia, inability to voluntarily move the lower parts of the body from the effect of wetting, Magnum and conium paralysis from below upward. Cold and damp weather causes symptoms to appear. Dose: medicine Lathyrus sativus 6, 12 and 30 potency, 1 to 5 drops in 10 ml water on empty stomach or as advised by your doctor. Wishing you a happy and healthy life. Thank you.